Good morning, everybody. Good morning. We're gonna start the meeting. We're live, Brian. What's he hard hearing? We're gonna call the meeting to order, and I'd like to accept the minutes of October 25th. Jay and Cassie and Jim. Thank you. All in favor?
Aye.
Thank you. Okay, we're gonna wait. Tammy? Morning.
She promised us quick.
Who for her?
Yeah, I know.
Oh, okay. It's like, I didn't make any
such
such promise.
You just want to know you're either going to save or more.
Thanks.
All right.
Nothing improves.
Yeah, all you gotta do is nod on everything I say, just keep nodding, we'll go really quick, okay? I did have listed that I wanted to talk with you about the care portal. And this is really just making you aware, you might hear about it in your communities. It is something new to Washington County and it's actually not launched yet. But the Office of Children and Family Services contracted with a platform that's called Care Portal. And it is being implemented in different spots throughout the state with the plan that it will go statewide. In our area, it's an agency called Justice for Orphans that is implementing it. And what it is it puts church communities in touch with requests from social services, essentially. If we have a child that has a need for something, we can put it out on this care portal and a church may say, we can do that for you. And then they will meet the need instead of us trying to find some alternative or our caseworkers having to go and do whatever. It's recognizing now that churches can help. We don't have to keep all of that separate. In the past, I remember presenting to churches about foster care recruitment years and years ago and being asked by them, what can we do to help you? And I was like, there's so much confidentiality and all the rest of it is very hard to say. This meets that need and provides for all of them. So as soon as they have 5 churches enrolled in Washington County, we will be going live with that and training our caseworkers. But you may hear more about it and we'll be looking for more churches as well.
So does that mean the state has a realization that they're broken and willing to work with churches now?
I think child welfare people at the state recognize that it's going to take more than just laws to get us
Still takes a village.
to take it.
You know, it's always been there. I mean, the Catholic Charities used to be one of
Oh.
your best resources. I mean, it's always.
No, it's just the disconnect of the state working that way is the problem.
This one we're supposed to not.
Yep, we'll move on to the next.
We're good.
Yep.
Who's against it?
Exactly.
Right. Election there.
We're gonna make it memorable for you, Roger.
Well, I may make it memorable.
I tell ya, something's rolling out here. I'm trying to, whoop. I got a little bit longer to go. Our employment workers from social services have been out in the county conducting outreach. I know that they've run across you. And so maybe some of you others have heard if they're going to town offices. I know they're going to different employers, talking with them about the population of people that we work with that are needing employment and what their barriers are and trying to have the companies be willing to take referrals from us and work with our folks. In addition to that, we're looking for work sites in the public sector and in not-for-profits. We've done this in the past. Some of you may recall having some of our workers out in different aspects. It could be in the town garages, maybe town offices. It needs to be, we need to have somebody that's ready and appropriate to go into whatever you have that you're making available to us, but it does work towards job readiness and employability skills for people. So I have flyers that I'd like to give you. This is a revamp from what we've had in the past. We just haven't been putting these things out. I've got colored and black and white. I want you to take several and hand them out to everybody in your communities in terms of different town offices, villages, not-for-profits. And then,
Did you get the black and white?
We didn't get-
They did visit our town office and, so between Pat and I almost felt sorry for them.
oh, I don't, they came to talk to me afterwards, I wouldn't feel sorry for them.
You know,
You got one of the tips.
So it was an interesting exchange, and I keep thinking about all that people can do sometimes, the gifts that they can bring to communities. And, you know, and we laughingly told them that every single daffodil in my yard has been planted by someone that needed the job. And it's a gift that keeps on giving.
Money.
I got some more too, if anybody wants to.
So this is kind of like, we only need them for a few hours or
It would be whatever you do need, we would be trying to match somebody to that.
even if it's just temporary?
Yep. Yep, and you know, perhaps when they get in someplace, they might make some contacts. We've had people that then become employed or hired by, you know, wherever it is that they're working. They may get in with a group of people and hear about some other opportunities. They may decide that what we're asking them to do is not what they want to do, and they could find a different path as well. So it can also be diversion. So just if you have anybody, any questions, the number is on there, or no, the number's not on there, did it? That's silly. Why wouldn't I put a phone number on there? But you can call, my number and we will forward you through, but it is Karen Miles, that's the supervisor, of the unit. And then we have 4 workers that are going out in the communities and would be able to come and speak with you as well. My number, do you want that? Is that what you're looking for? 746-2323.
746.
2323.
Unless it's after the right.
Okay, moving on. The public welfare meeting will be in Albany on December 14th, and I would like consent to be able to stay the night on the 13th.
We have a second? Okay, Deanna, Jim, discussion? Is there any discussion? All in
Get
favor?
ready to not.
All in favor?
off.
Thank you. I am going to be reappointed to the executive board for the Public Welfare Association come January. It is unusual, but apparently I've been around long enough to be back through. But I'll be the treasurer, and I've been the treasurer before.
Yeah, congratulations, team. I know that's a lot of extra work and responsibility,
Thank
but
you.
it's paid off for the county and it's paid off overall for the organization. So
Yeah.
thank you for sticking with that.
Thank you. And the last thing I just want to share with you, I met with Andrea Deep. She's the CEO from Ascend Mental Wellness on Monday. And they are looking towards applying for an RFP to bring an additional supported housing program into Washington County. So you all know well from me that there's a huge need for housing, and this is looking to be both a long-term solution for families as well as short-term interim help for them as well. So they'll do a mixed, it has to be mixed. It can't be only people that are identified by mental health as needing services. So I think it'll be very beneficial for us.
Do they know the location?
They do not. There are a lot of stipulations and
This is first step.
this is the first step, yes.
Right.
So Kimmy, are these, maybe they're not this far yet, are these gonna be like one placement homes with several places for people to stay, or is it gonna be?
It's gonna be
like
one,
Existing apartments or?
it's gonna be one structure. And I think they would call it multi-use. We are looking at doing interim, like immediate placement, something that'll transition people through to something else, somewhere else, as well as permanent residences there for people. And I have said that I feel that there's a great need for families. Typically, these have only been for single adults, but they are also interested in meeting with families.
may be a connection here between the peer-to-peer program
Mhm.
for veterans and their families could benefit from this as well.
Yeah,
We just had a meeting last night, we discussed some of that, so.
okay, yeah, good. This is just the beginning, but I'm glad
Yeah, that's
that's,
great.
you know, they're out there
And that's something they're gonna own if
Yep.
they can do it.
and they have sites now.
That's all I have. I did bring up Ben Yates yesterday in
Oh.
public safety,
Mhm,
to talk about transitional housing out of, the jails.
mhm.
So it was brought up at public safety and at this point, I think the sheriff was looking at that as an urban, not necessarily a rural correctional facility.
I think that being able to help people transition and do so from the jail, being able to stay at the jail when they're no longer incarcerated is something that is more possible in a bigger facility. You know, like what presented itself or has presented itself in Albany. I do think that there's an opportunity to help people that once they have left from, once they are no longer incarcerated and they've been released, to work with them specifically around the barriers that they have to being self-sufficient.
So, yeah, I think Saratoga County does it too, so.
They're doing,
So
yes,
it's working its way north.
yes.
Thank you.
Thank you.
Okay. She's running up to the. I said you were running up to the.
Oh, I was very excited. Good stuff to share with everyone today.
That's fine.
Good morning.
Morning.
I wanted to share with you a new service that New York State Office for Aging has started. Apparently, the state has contracted with a company called Blooming Health. And Blooming Health is basically, in a simple way to explain it, it is a way for us to communicate with our consumers. So, for instance, if we have an announcement that we want to make about an upcoming event, or for instance, if we're notified about a pretty popular scam that's happening in our area, or when our programs close, our nutrition program closes occasionally because of poor weather conditions, we're able to send out a news blast per se. And that news blast can go out to the consumers by text message, by phone call, by email, whatever preferred choice that the consumer wishes to receive the messages in. So the neat part about this program is that we can also conduct satisfaction surveys. So we can send out, an information announcement and say, what did you think of the stuffed peppers today? We can also share events that are happening. So it's a great tool for sending immediate information out to our population. Again, this has no budget impact for us locally. The New York State Office for Aging is covering the cost, but the requirement is for us to engage in an agreement. So today I'd like to request permission to engage in an agreement with Blooming Health for these services.
Okay, do we have a motion to?
So by Roger and everything's good.
So I have the agreement here. I have not forwarded it to Roger. For him to review. So that would be the first step, is to send it his way and have him review it.
We overcome the client list issue.
We did, yes. So we've already started a conversation about sharing our client information with this organization. And Roger and I agree that consent, whether verbal or written from the consumer, is necessary in order for us to provide that information to the company and engage them into the service.
They want us to just give a list of everybody to deal with and then maybe people that aren't interested in this service. So,
That's good.
so we're gonna make sure people want it before we provide it.
And how is the service done? Is it done by telephone? Is it done by text message, internet?
Correct. Yeah,
Oh,
yeah, it's a text. So it's whatever phone number they choose. It can be a landline, it can be a cell phone, it can be a text message, it can be an email.
Are the clientele that sign up for this is gonna be inundated with solicitation through this outfit?
We would be the keepers of it. So at this point, all communications would be stemming from our office. So if you say inundated, that's.
Well, I just meant, I didn't know if they had that client list there and they had people
No.
that paid them to put stuff out.
Correct, that, my understanding is not going to happen. This is, so also this is a year agreement, so we can feel it out in the next year, but my understanding is that we have full control of the information that's being sent out to our consumers.
You talked about your client list. Now, what makes up the client list?
So at this time, it would be people receiving services from us. I'd like to start specifically with our home delivered meals recipients. Start there. So, you know, if approval is received, I'd like within the next week to get consent from those individuals. And have the system start within the next few weeks. We have to provide, I believe, a W-9 number in order to get some special line to be able to promote this, the service. And so that takes about 3 weeks. So I guess for us to really get it up and running, we're talking about a month.
I'm curious, is it person to person or is it an automated?
So it's an automate both. So we could design a message. So for instance, if we want to personally record a message, we could put that out there.
Gina, what did you just say about W-9?
I'm sorry,
Did you say something about a W-9 just?
correct. So they're asking for a W-9
Okay.
number and submitting that for a special line, I guess, to facilitate these messages,
Our W-9 is available on the P drive. You can just grab it and send it.
the P drive.
You can call them later to see what the feed run is, right?
Yes, I don't have access to the P drive personally, not
You don't?
on the state network. The state network does not have county drives, but we have ways to get that information.
I'll send it. Let's do that.
We always get the
Let me
information
just-
some way. Yeah.
I'll move that,
Yeah.
start the program on.
I'll second that.
Thank you.
Any more discussion? All in favor?
Aye.
Thank you. And most certainly, we are not looking to inundate people with information. It most certainly will be really on the need basis, and really excited to talk about when we have, like, for instance, we work with public health for the Tai Chi program, in certain areas. We can create an announcement that targets that area specifically where the class is being held, and then put it up there to folks. Thank you. That's good. I do have one other item that's not on the agenda, and as you have seen, we have sent out our letters requesting for appointments to our Office for Aging Advisory Council. Individual members appointed have 2-year terms, and everyone's term is up at the end of this calendar year. So we have forwarded out letters to you. We have talked to the current advisory council members, and most of them, except with the exception of one individual, is interested in being reappointed. So you can call me directly if you have any questions. Okay.
Thank you.
Thank you very much.
Morning, everyone. I think the first thing on our agenda is to recognize the Early Intervention Administrative Grant. It's a grant we get each year, covers our administrative costs for, covers some of our administrative costs for the Early Intervention Program. The amount is $38,779. So just looking for, resolution requests.
Okay, asking Brian second. Any discussion? All in favor?
Aye.
Thank you.
Will that be 2023 activities?
Right, because it started October 1st, and then we'll carry it over in January. Yep. And then the second thing, I just wanted to update you all on we had mentioned back when we were doing budget, about the preschool budget. projected shortfall. We are still anticipating that shortfall due to the increase in the number of children. So the shortfall is approximately 406,000, but we do get 59.5% back on that. So we're looking at a net shortfall of about 165,000. And again, this is due to the significant increase in the number of children within that program. So I'm not sure how we want to handle that, if you want to add money now, or you want to wait until.
We'd probably wait till year end,
Okay.
because that's still gonna get bigger, I assume.
Yeah, we're hoping not, but we did just receive 2 rate reconciliations that added about $35,000. And we don't know when we're going to get those, so it's, you know, I would recommend waiting until.
Yeah, we kept money in contingency just for this case,
Mhm.
but I don't know, I assume it'll still cover it, but do we wanna do that by year's end or just by the time you close the books? Cause we can amend it in 24 for 23, right?
I look at year end is when I close the books.
Right.
So
So we can do it anytime in January after we know.
it'll probably be February,
Might be
I guess,
February,
before we have
March.
final,
Yeah, it could even be March.
could be even March.
Depending on when we receive the
So
vouchers.
we kept that money in contingency to cover that, so.
Yeah, there is a cushion there to
Right.
anticipating that need.
Okay.
But
So
the
when,
timing, I wanted to leave up to Brian to.
Yeah,
okay, and so when we submit the vouchers and if we do go
They'll be paid.
negative,
Yep.
will we need to call you?
No,
You for
the
approval of
vouchers
that,
will be
or-
honored.
Okay.
thank you.
And then I just want to give you a staffing update. We have had 2 vacant full-time RN positions for quite some time now. I did talk it over with Danielle, and we do have someone interested in a per diem nursing position. So what we'd like to do is have this person fill one of the per diem or one of the full-time positions temporarily until our goal is to have full-time. And this person is aware of that this would just be, you know, until we're able to fill the full-time position. Danielle did not think it had to be added to the staffing pattern or anything because we're using an existing position that's already there. So just looking for permission to do that, to fill with a per diem nurse.
Brian first, Dan second. Any discussion?
With per diem, there's no benefits, is there?
Any opportunity that the person will like us instead.
Benefits are-
Possibly.
So.
Now, under per diem, does that still qualify for whatever share that the state reimburses you on for?
Yes.
Okay.
Yep.
Okay, all in favor?
Aye.
Thank you. And then just a few program updates. Our certificate of need, we were able to submit that a few weeks ago. We did receive notice yesterday that they had received it. Then we received another notice this morning that in addition to the $1,250 fee, there's also a construction fee that goes along with that. So we will be requesting another petty cash check in the amount of $1,600. And then again, that's in addition to the $1,250 application fee. So then once they receive that, then they'll move forward with reviewing their applications. So I don't know if I need approval for that.
The
Okay.
resolution's got it all covered, so you're
Okay.
good.
Okay, all right, so, but the good thing is it's been submitted and it's in process. I wanted to give you a quick flu update. We are seeing a significant increase in the number of our flu cases. We are pretty much consistent with where we were last year, with the exception of hospitalizations. Hospitalizations last year were significantly more than they are at this point this year. So, and we are getting out to the farming community. We have 2 farms already scheduled and then 2 also in the works, you know, to get our vaccines out there. And that's more than just flu, it's whatever they need. So we're working on that. And then early interventions, just wanted to give you an update on the wait list there. It is better than it has been. We have 5 kids right now waiting for speech therapy, 2 for occupational therapy, and 1 waiting for social work, but that definitely is an improvement from where we were. So that's a good thing. And then I just wanted to make sure you were all aware of the applesauce recall that is out there. It's the cinnamon applesauce pouches, that are in our area are sold. You can either get them on Amazon or they're sold, in the Dollar Tree stores. So it's this recall here and it's causing elevated lead levels, in children, and they found that it's the cinnamon, that's within the applesauce. So, it is a pretty big recall, with significant impacts. And it is across the nation, but it is affecting people here, in New York State. So just want to make sure you were all aware of that. And if you need more information, it is on the FDA, website, the recall. So, just so you're all aware of that. And then good news, Fidelis has announced they're doing another dental clinic, next door to our buildings. And based on the feedback they got from the last one, they are going to do it on a weekend, this time. So it's going to be, Saturday and Sunday, December 9th and 10th, and also Monday, December 11th. And I do have the information on that. You know, if you want to they don't have a flyer or anything, but they did give us the number, where people can call, to schedule those appointments. So, and it is for children this time as well as adults. So I can send you all the number through email if that, works. So you have that for your communities. And I think that's all I have.
The last one ended up filling up.
It did.
Totally.
Yeah,
Which
yeah,
is
it was,
amazing.
it was great. Yeah, so hopefully this one will as well.
Yeah.
So,
Now, what did they provide in that service?
Full service for.
full service dental.
Do they bring the dental chairs right in?
No, they actually have it actually looks like a big, huge horse trailer, that they pull up.
Yeah, that makes sense.
They pull up next door and they have a generator running all day. It's at the building right north of us, the St. Anne Institute, is where they park it. And that, yeah, it was pretty busy last time, so hopefully we'll be.
Is there qualification, I'm sorry,
ahead,
are there
Anna.
qualifications on who is eligible or? is-
Yeah, you have to be a Fidelis member. Although this time they did say if there's openings or if there's room, they would possibly open it up, but their priority or they're doing it for Fidelis members, within our county and other counties. You can come from other counties as well. So,
Any other questions? Thank you very much.
thank you.
I believe I really will be brief because I would just like, I, meaning our planning group, and I would like to mention for Winterfest this year. If all things go well and it's not a wind chill of -30 and rain. And we really, snow would be preferred, but we will have it regardless of snow or as long as the wind chill is not there and it's not downpouring. We will hold Winterfest.
Nancy moves it, Jim seconds.
Thank
Any
you.
discussion?
So do you need any permissions for use of the logo and food and stuff like that? You might as well take care of all that now.
So use of the logo, we really don't, you know, the Winterfest flyer really does just have the thank you, everybody who participates. And the food is donated by the sheriff's department.
Just
So,
check it, 'cause in case you need it, you
yeah,
might as
so
well
the
just.
food is donated by the sheriff's department. The logos, we really just have a simple Winterfest flyer that we put out there that has, you know, sledding. We do the funds that are already in our budget are to pay for the porta potties and, the horse-drawn wagon, which I think the decision has been made that everybody enjoys that, so we will, contract with the horse-drawn wagon. So I think everything else is,
Okay.
and, you know, a lot of our departments are collaborate with this, so it's a great, hopefully,
Good way.
all goes well.
Yeah.
And if you have any gently used skates that you no longer want, you can send them our way, because we have barrels of them.
Great.
Thank you.
Yeah. All in favor?
Aye.
Thank you.
Thank you. Sue gets the award. So.
So far.
Good morning.
Good morning.
Oh. Sorry, I have much of a voice this morning. I'm gonna try.
So I am Shelley, I'm the executive director at LEAP, and I'm coming to you this morning because we have requested just to take a look at some of the contracts that LEAP and Washington County have had for some of them for a very long time without having been reviewed for a while. So this was driven by a couple of things. One, of course, is partially finances. Some of them have been in existence for a long time with no change. Also, just in my role as executive director and with my current leadership team, it is our desire to do everything that we can as well as possible, to make sure we're as accountable as possible, and to have good relationships with everyone that we're working with. And so we wanted to kind of review these agreements and make sure that we are doing all that we need to do in this as well. So there are 3 of them that we've taken a look at. One is really easy. We have a maintenance agreement. I believe there will still be some changes, right, to
Just some editing.
some
wording
clarification.
changes. Yes, with meeting with buildings and grounds.
Okay. This agreement is because there are several buildings that LEAP uses for Head Start purposes that are county owned. We use them as an in-kind donation for the space. And the maintenance agreement really, it covers basic maintenance of the buildings. LEAP is responsible for cleaning and that sort of thing. It does require some clarification. There are some, as a matter of fact, right before I came here this morning, someone said to me, is this something we call accounting for, or do we do this ourselves? I said, look at the contract and figure it out. So we're working on making sure that those things are clear. We do receive from the county right now $37,980 a year to go toward the janitorial costs. We've contracted with All Pro Janitorial to take care of these buildings. It costs us significantly more than that, but we do want to make sure that the buildings are well cared for, that the staff and that the children are safe at all times. So that is one of the contracts, and we're not looking for any monetary change there. Any questions on that one? Concerns or anything? No. Okay, the next one is a transportation. We have worked with Gina, with Office for the Aging, for a while to provide transportation. Let me see, when was this? This contract was first entered into in 2002. And until recently, the most recent revision was in 2019. And there was no termination date at that time. So that's also another reason that we wanted to take a look at these contracts. We really, because we answered the Office of Head Start and the Office of Community Services for our grantors as a community action Head Start agency. We actually are required to enter into contracts for no more than 5 years at a time. So open-ended contracts really we're out of compliance with those. Another reason we need to look at these. So this one is one where we are asking for an increase. What we're asking for is an increase of $38,000 a year. That is, the total was $108,428. We're looking for $146,428. And what we do for that is we provide eligible older adults in Washington, I'm reading directly from the contract, eligible older adults in Washington County for medically related and social needs, transportation to them. In addition to medical appointments under the terms of this agreement, trips to Social Security, social services, pharmacy, shopping, banking, nutrition sites, meeting, health and wellness activities, etc., are understood to be appropriate transports. We also give each consumer the ability to make a confidential contribution that would then be mailed by the consumer directly to the Office for the Aging. We're only the middleman in giving them the envelope that they can use to do that. We don't collect any donations ourselves, and our drivers do not take tips at all. will maintain and provide Office for the Aging with monthly reports, including mileage, destination, customer name, demographic information, units of service, all of the things that they've requested, and we're keeping records of all of that and reporting regularly. We also are as one of the aspects of this contract is outreach. And LEAP does quite a bit of outreach specifically regarding our transportation. We have not always documented that outreach piece very well. So that is something that I made sure we clarified in this contract, is that we're documenting that. But our transportation coordinator is at the meal sites. She's out doing things with just to get the information out there to the aging community that this service is available. On top of all of the wonderful things that Office for the Aging does for the community, our drivers are also sometimes the only person that people see, right? Like you were talking about, I believe we heard this morning at the state of Washington County, talking about delivering meals, right? And our drivers have had similar experiences where they develop such a relationship with the people that they are transporting. I believe it's a safety net for the people that we serve. So that is, in a nutshell, the transportation contract, and what we are looking for there is an increase of 38,000. The last
I have a
contract.
question.
Yes, please, go ahead.
You mentioned outreach. Is there
Yes.
something you can give us, towns, that we can get that information on our websites?
Absolutely, I can share that with all of you.
That would be valuable.
Yeah, we have, I can give you information that you can put on the website, I can give you flyers, both, whatever it is that you would like,
That'd be great.
okay?
Do you or Gina have a number of people you serve during the year, or total mileage you do during the year?
We
Right.
have it, I didn't bring it with me today, I apologize. I don't remember, do you?
Fluctuates.
It does.
It does, because you can serve a low number of individuals with a lot more trips. And
Well, that's-
so,
yeah.
Or it could be vice versa. You can serve less individuals with more trips, more individuals with less trips. And so it does.
And if you were to look at like mileage over like the last 3 years, not necessarily locations, but has the mileage increased each year for recipients?
That I can't answer at this time, but we do collect that information.
Right.
So you're asking for an increase, we just finished our budget, was that budget?
Yes, that was budgeted, yes.
Yeah, Shelley did attend the budget meeting with Gina, and that amount was budgeted. I actually shared with the board at that time.
Yes. Yep. The amount was budgeted and, yeah, so that's the increase we're looking for. Gina did, put that in the budget, and we're thankful, for the opportunity to do
I
it.
think Dan has a question.
Yes, you've stated that you work with the Office of the Aging back and forth. It almost sounds like you both share some of the same functions in it, or is it, I mean, like transportation, you were talking about that.
Right.
And I think, doesn't the Office of the Aging provide some transportation?
So with using aging funds, we provide transportation services to individuals, Washington County residents, age 60 and older, through the contract that we have with.
Oh, with LEAP, so.
Yes.
Correct, so.
Yes, they do, they contract it out.
Contract to us.
Okay, I thought you were both doing it, and it
So it's one
wasn't,
and the same.
No,
it wasn't understanding.
that's how that is through our contract. We do, prioritize, even though all of the social engagements and so forth are included, we do prioritize medical. If something comes up, a medical need will take precedence over something else. We do not turn people away. And we do all we can to make sure everyone is transported, and we're hoping to be able to expand and offer more hours The evening hours are a difficult time right now. As Gina well knows, and she and I talked about that some. I don't know what that's gonna look like. That's just me dreaming, but we'll see how that goes. So that is the transportation. Anybody have any other questions about that one?
I'll move it if Roger's okay with it. That's,
I think they have a good contract.
but that,
It's a good contract.
we review all, right?
No,
Yeah,
more.
individual.
What's that?
She has to present one. Right, you have one more
Yes,
to
I
Or,
will.
discuss.
right, I thought we're gonna look at each one individually.
We did the first one. We were just listening.
I'll go ahead and present the food pantry contract. And so this one is, it was originally, it's a contract with the Department of Social Services with the county, originally dated 2007 with no termination date. It was executed at the time by LEAP and the chairperson of the county board of supervisors. And it is for the administration and distribution of food to Washington County residents. The amount of the contract currently is $22,000, $22,020 a year. It's an odd number. And this one was not presented in the budget. So this is the one that would be an increase that we're looking for, that would be additional to what you've already budgeted for. What we are looking for here is an increase of $20,000 a year. And the services don't change in that we serve Washington County residents as a community action agency. We do we collect financial information on all of our clientele, and for community action or CSBG funding to cover these services, we are restricted to right now 200% of the federal poverty level for CSBG funding. That was just continued with the continuing resolution. It may go back to, it was 125%, as you're probably aware, prior to COVID. So it's been at 200 for a while. The continuing resolution has kept it there. Anybody outside of that scope, we are not covered by our CSBG funding to assist them with food. However, we know that the continuing rate of inflation, the cost of so many things, cost of commodities, all of that has risen to such a point that it's kind of twofold here. It's difficult for families to make ends meet. And it's also it's more costly for us to stock the pantry. And social services does have access to this pantry. We have our staff and their staff know how to manage with the paperwork that needs to be filled out and that sort of thing. So they have unlimited really access to the pantry as well. And as I said, the drivers for this request are really the inflation has been a huge one. Also, minimum wage, the minimum wage increase, it costs us so much more to just to staff this pantry, for the staff that, and minimum wage has gone up everywhere, which is a good thing, but it's a difficult thing as an organization. I think, just keeping up with that has been a challenge. And also, one thing that I've noted, especially recently, is that the rate of homelessness and those who are housed in hotels or temporary shelters of some kind has actually had an impact on the costs of running the food pantry. It sounds a little bit strange, I know, but when people are living in hotels, placed there by the county, right? They are limited to things that they can microwave. They don't have a lot of storage. The amount of food that we can give them and the quality, unfortunately, but also the way that the food is, like, we can't give them a bunch of ground beef and that kind of thing. We can give them meals that are ready to eat, microwavable. We also provide can openers and things like that. All of these things they're not covered by the regional, they're not carried by the regional food bank. We also have, we receive grants from, but those grants have gone down as well. And those are pricey. They're hard to keep stocked. And with this increase that we've seen in homelessness and in those that are housed in hotels, it has cost quite a bit to try to keep those food items stocked in our food pantry. So that is the bigger ask here, because this one is not in the budget as it was presented. We're looking for an approximately $20,000 increase. I say approximately because it was $22,020, and what we're looking for is exactly 42,000. So it's, just a little bit off. So approximately $20,000 increase there. Yes.
I just wanted to add, so that the committee's aware that the budgeted amount for the food pantry and the Head Start cleaning and maintenance is under 6310, which is community action. And that amount that's been budgeted is $60,000 and has been, for how long?
Long time.
Long time.
Yeah.
So that would be the line 6310, 4290, that we'd be looking to increase the $20,000 if we wish to do so.
We could probably pass the contract, but we can't amend the budget.
Just that said, it's not part of the DSS budget. Wow, it's contract.
Right.
Ostensibly was with DSS, it's not part of the DSS.
Right. Yeah. Should it?
No.
So what's the total increase? Because these are all increases in the contract, right? Even though they're in
Just
the
the one
budget.
was 19,080.
Yeah.
Oh,
But the other ones, they were all increases.
Between the two,
one,
the only
one.
two of the three were in. We're
Right,
asking
but
for
then
an
there was
increase.
three that.
Right, so the two combined increases that we're asking for are 58,000. One is 38,000, one is 20. The 38,000 is the one that's in the budget, the 20 is not. And the other one, we're not looking for an increase.
There was only two then, I thought there was a third.
Yeah.
Where's the?
The food pantry is actually in, a Washington County building, the one that was, I believe it was in.
Annex two.
Annex to, thank you, I don't know the names of the buildings. That is where our food pantry currently is. And we deliver some, we have reduced the amount we deliver, but when people need, if people really can't get to the food pantry, or those who are, right, just have physical limitations or transportation limitations, we will transport also. So any other questions?
Yeah, I don't know who this should be addressed to. So the co-program we used to have, or still have, where is that currently being managed out of? Who handles that? We had it for the youth and for the elderly and that type of stuff. That's still through Lee, is that?
I'm not.
Co-closet.
Co-closet,
Oh, coat. I'm sorry, that's not what I heard. Yes, we are still doing that. Yeah.
and those coats are allowed to wear when you send people up there to rest of the day.
That is, it would be through our career and family services suite downstairs. They have, I mean, they don't have them in that suite, but
But they've got access to them.
yes,
Got it.
absolutely.
So if we had donations, we take them down to that office.
Yeah.
Got it, thank you.
You're welcome.
Any other questions?
Yes.
Shelley, could you provide an accounting, of the food pantry cost? That we'd ask that of anyone. It's not specific to
Yes,
Lee.
yep, I certainly can, no problem. I mean, again, I don't have it with me today, but
I
I
know,
can send it to
that's
you.
fine. I know where you live.
Yeah.
Right downstairs.
Actually, she's not.
Well, true.
I'm pretty mobile these days,
Yeah.
but yes, I can get that to you, not a problem.
We know how to get to you.
Okay, all right, great, thank you very much, appreciate it.
So we can approve the contract, we can't move the money. That's correct.
Yeah, right.
So.
What does that mean?
And so we can approve
Means you
two
have
of
to
them.
amend it in
Right.
January.
We can make a motion to approve the
Now,
The Head Start one, that was the first one with no money.
So we want to move them in so that the chair can
Individually.
sign those contracts.
Right, so the first one, that had no money involved with it.
Do we have a second on that?
I'm just- I can live with that.
Okay, all in favor?
Aye.
Okay, so that's the one, how about the second
The
contract?
transportation one, the money's already been
It's already there.
budgeted,
Yes,
so you're all set with that one. So I'll move that one to get that one done.
okay. And Jim's gonna second it. Any other discussion on that? All in favor? Thank you. Okay, and on the food pantry, we're going to wait and get information from Shelley to Al. Revisit that.
I don't think there's any harm in waiting and doing it in January, so you can do the contract and the budget all in one resolution.
Okay.
I have to ask this question. What if it wasn't approved, that amount of money increase? What does it do to your organization and your program?
We would continue to operate as we do. Our food pantry is operating at a pretty significant deficit right now. We are doing all we can to, there's never been a lot of fundraising at LEAP, but we're working on that. We rely so heavily on government grants that we just don't have a lot of flexibility. But we're working on increasing that flexibility. So long story short, our services aren't gonna change. We may have to tighten our belt.
The only thing is, you want to think about this, is that that contract was done in 2007.
Oh, no, I know that, but
And
it's
so,
good to know if somebody wanted to vote no,
right,
what are they doing? You know, what's the impact?
Shelley, I think in one of our discussions, you had told me that if there's shortages for some services, that money comes out of other services that you provide. So if there wasn't money to add to your food pantry and you're running in a deficit, that money would come out of maybe workforce development or funding that you would use for workforce
Other-
development
yeah.
or other services.
In some way, there are some ways where we can't, where we have those restrictions. Things have to be used for very specific things, but yes, specifically within emergency services, we're going to make sure people have food. So some of the things that would be impacted by us continuing to operate that food pantry at a deficit are things like when we help with utility assistance or rental assistance, or sometimes we are able to help people with other needs like clothing codes, that the code drive we have, of course, things like that. So that really, all of that lies in the community action piece of LEAP, which really is our most emergency services focused. Head Start is very family focused and very development. It's about helping people to move forward, and so is workforce development. Community action is very emergency services focused. So if we're operating at a deficit in the food pantry, the other services in that area would be impacted. Thank you. Thank you very much.
okay, hi, Brad. You wanna come on up?
You going first?
Good morning, everyone. My apologies, I had missed a deadline actually for submission of these requests, so I did ask if I could tag on to the end of the meeting here. I have two quick requests. Resolution request to reappoint 3 members of our Washington County Community Services Board. That would be Tammy Gilmore, Jennifer Hogan, and Linda Bouchard.
Okay, so Brian moved, Dave seconds, any discussion? All in favor?
Aye.
Thank you.
Thank you. Second request is to amend the 2023 Washington County budget in the amount of $6,537. This is 100% state aid funding from the Office of Mental Health, designated for Ascend Mental Wellness.
Brian moves it. We have a second. Any discussion? All in favor? Thank you.
You're not coming with a bill?
Yeah.
I'll have a question for you.
Right, while you were here, were you gonna share your good news about your 2024 opioid?
Yeah, we did receive some additional opioid funding. It was a larger amount than we anticipated. I don't have.
191,512.
Thank you.
I know a guy.
I'm resting, right?
Yeah, very nice. Yeah, we're forward to that, and what we'll be doing is we're doing our RFP process in Warren County, so we'll kind of mirror that. Washington County response. They're different than the county direct ones. That's cool.
We may want to respond to your RFPs.
Thank you very much. Any other questions for Robbie before he leaves? Okay, we're all set. Okay. And that, unless there's other business, that concludes human service date. Oh, the date. For the next meeting. Yes.
So good on the 19th, right?
Yes, yes. So all in favor of that? Okay. I guess we're adjourned. Thank you very much.